new polling data out, and it shows most Americans don't support the health care overhaul legislation that's currently moving through Congress, the current legislation. This is a new Fox News Opinion Dynamics poll. It finds 51% of Americans oppose health care reform. Based on what they know about current proposals, 35% support it. Republican Senator Saxby Chambliss of Georgia is joining us now from the Russell Rotunda on Capitol Hill. Great to have you here, Senator.
Good to be with you, Juliette.
So what do these numbers say to you? 35%, just 35. Well, some would say 35%, and then others would say just 35% support this legislation. What are these numbers saying to you?
Well, what the numbers say to me is that the American people have finally started getting it. They've been outraged about the spending, not just the spending associated with this massive intrusion by the federal government into their personal lives, but all the spending, Juliette, that's been taking place over the last 11 months since this administration's been in power. And folks are really upset now about the fact that the federal government is taking over so many aspects of our personal lives, from finance to automobiles to this so-called stimulus package that has not stimulated the economy, to now the government's seeking to take over 17% of the economy by taking over the healthcare industry. So I think the American people have rightly been upset about this, and we're going to have an interesting next several weeks and maybe next several months as we get through this process. And maybe evening. And as a matter of fact, it was just a week ago today that we were talking about poll numbers here. And Americans overwhelmingly, I mean, whatever side of the line you're on, Americans overwhelmingly say that they are most concerned about the economy, not health care, not health care reform. Yet the Obama administration, to many critics' dismay, pushes on with the health care agenda. When is the right time to start debating health care reform in your mind? Well, I had hoped that we really could focus on the economy before we ever got into the health care debate, but the administration has been so confident that the massive spending package that was passed back in the spring of this year would be taking effect by now, and that employment would be coming down, and we've seen exactly the opposite. In my state, we have about a 10.5% unemployment rate. That's a little bit higher than the national average, and you know, folks back in Georgia are really hurting, and while they're concerned about health care, they're concerned about the other issues I talked about. What they're most concerned about is their jobs and being able to provide support for them and their families. And I really had hoped that we could do some positive measures with respect to getting this economy really churned up again, and then let's take on health care. But that's a decision the administration had to make. We get a lot of emails from viewers say, enough of the filibustering and the debating and the talking and the arguing. We want to know what our health care is going to look like in a year from now. As one of your colleagues there, Republican Senator, earlier said, you know, it's kind of like the layaway plan. We're going to end up having to pay for a lot of stuff right now, but we're not going to see any benefits for 4 years, 5 years from now. What are you going to tell these? What do you tell these folks who are writing in and who are emailing in saying, what is it going to look like? What do we have to look forward to? Well, what the Democrats' proposal does say, the one that we're going to be debating and what we're voting on really going to the floor tonight, is a plan that does call for higher taxes, significantly higher taxes, to be put in place next year. Even higher taxes to be put in place January 1, 2011. And then the benefits that are going to be provided to people under this bill will not take place until January 1, 2014. That's what people really have a question in their mind, and they're asking us, gee, what is this really all about? Why are we not getting benefits now if we're going to be paying for them? And there is no good answer to that, because what they've done is gimmick this thing up so much that there's no practical aspect to it that people can really identify with. And once again, we want to point out, as Julie Banderas and Greg both pointed out last hour, we have been reaching out to Democrats from the Senate today. Nobody was able to join us or willing to join us today. So we appreciate you joining us, talking about this, and you know, we'll be watching tonight. Definitely. Thank you very much, Senator Saxby. It's going to be an interesting several weeks and months to come. It sure will. Thank you. From the beautiful state of Georgia. And by the way, the Senate health care bill will be the hot topic tomorrow on Fox News Sunday, so make sure you join.